Patient Care Connect is a lay navigation program that provides support to cancer patients from the time of diagnosis throughout their cancer journey, including survivorship and end of life. This program really developed as part of two different ongoing efforts at UAB. The first is our long history of navigation at UAB. So we had been navigating patients for over 20 years, addressing the needs of patients and access, particularly to improve disparities in patient outcomes. And that was a foundation which was included as well as our emerging UAB Health System Cancer Community Network. And that network is a partnership with hospitals and physicians within community settings in the region. And those together were the foundation for the Patient Care Connect program. There are several things that make the Patient Care Connect program novel. The first is the idea of navigating patients across the continuum of care. So many of the previous navigation patients focused on either screening or early treatment, but we really felt like this was an opportunity to provide this extra layer of support for cancer patients across their continuum through survivorship and end of life. Another aspect that was really novel about this program was the idea of using a lay navigator. So this is a person who is from the community but not a nurse or social worker. And they really provided the ability to reach out to patients and give a holistic approach to care. Many other programs focused on nurse navigators, which are also very important, but that tends to have a more clinical feel in terms of symptom management, where the lay navigators are able to also address things like practical barriers like transportation and housing and scheduling issues, as well as spending more time with patients in terms of the psychosocial support that they need and connecting them with resources. So the bottom line is that we found high value with better health care as well as cost savings to Medicare. The Patient Care Connect program is a great program, and navigation services are expanding across the country. This program can be a national model for other locations. Navigators really make a lot of sense as a program that can bring high value with high quality and low cost to health systems.
As a navigator, we work with patients at the very beginning of their diagnosis to either end of life or survivorship, and we work with them to empower them through the process of their cancer journey. We help with planning, we help identify health literacy issues that they might have. At appointments, we will go in and we'll help do something as simple as take notes, or we will help them in advance, actually coach them through the process of talking with their provider. A great plan mapped out, helped of course by their non-clinical patient navigator, can really improve their experience. As you can imagine, cancer can be very overwhelming for patients, and so a lot of times we are dealing with a lot of emotions, but ultimately we develop a trusting relationship with them where they're able to share things with them, and we really work as an advocate and a liaison for them to participate in the process of their care.